Tonight for an assessment of what happens next from two leaders who will be counting votes. Rahm Emanuel of Illinois is chair of the House Democratic Caucus, and Eric Cantor of Virginia is chief deputy whip for the House Republicans. Gentlemen, thank you both. It's good to see. How worried are you and your Republican colleagues that they will have enough votes to override, especially when the polls show, 7 in 10 Americans support this expanded child health insurance?
Well, Judy, I'm very confident that we'll have the votes to sustain the president's veto. And
the taxpayers pay for our health care and for the health care of our children, the same Blue Cross plans, the same WellPoint plan, the same private insurance plans that these kids get. If it's good enough for us and good enough for our kids, it's good enough for the taxpayers who pay this health care.
Congressman Cantor, what about that point and his earlier point that these adults you mentioned would be phased out under this expanded plan after 2 years?
Well, first of all, the taxpayers don't pay for my plan because I'm not on this plan. So,
who's right here?
I'll tell you, the Washington Post says that this is a move towards more government-controlled Washington-based health care. Our own Congressional Budget Office says that 1.6 million children will move off of the private insurance plans and onto a Washington-controlled, government-sponsored health care program. Again, Judy, I'm very confident we'll have the votes to sustain the president's veto because I think that members of our conference, as well as some of Rahm's who supported the position that we've taken in rejecting this expansion, want to make sure that poor kids get their health care first.
Judy, I wouldn't say that of the American people, but to the 15 Republicans who've decided to uphold the president's veto, they have rubber stamped him on the war, they have rubber stamped him on out-of-control spending, and I can't give him political advice, but rubber stamping him on denying 10 million children health care, don't make the old chant. They have been rubber stamped.
There's no rubber stamping here. They're in control. So we don't have a rubber stamp. They're in control here. It is on their watch that the poor kids of America are going to be without health insurance coverage, and that's what it's all about. We've got to make sure that poor kids go first, and then let them, if they want to expand in their states to families making over $80,000 a year, then they can go at it.
We have to leave it there. We've already got the date, October 18th, circled on our calendar. Gentlemen, thank you very much. Eric Cantor, Rahm Emanuel. Gentlemen, thank you both.